The goal of embryo transfer is to gently return your best available embryo to your womb, creating an opportunity for you to conceive a healthy pregnancy. Success rates in IVF per embryo transfer are relative to your age and clinical circumstances. At best, for young patients, a healthy and genetically normal blastocyst will have a 50% or 1 in 2 probability of achieving a birth. In embryos that have not been genetically tested and confirmed to be normal, at 30 years, the chance is 1 in 3. At 35 years, the chance is 1 in 4. At 40 years, the chance is 1 in 5. Over 42 years, the chance is 1 in 10. Over 45 years, the chance drops dramatically to less than 1 in 100, where a person's own eggs are used. Success rates using frozen eggs or donor eggs can be calculated based on the patient or donor's age at the time of egg collection. It is extremely common for patients undertaking IVF to require several embryo transfer attempts before they conceive. Each embryo transfer is a chance to conceive and should be optimally prepared for. You may be advised to defer your embryo transfer to occur in a dedicated planned treatment cycle as a frozen embryo transfer. In some cases, a fresh embryo transfer will be planned. In active IVF treatment, where the ovaries have been stimulated with hormone injections, your luteal phase after egg collection is always progesterone deficient. For this reason, high-dose progesterone hormone therapy must be used between egg collection and your pregnancy test in a stimulated IVF cycle to ensure your embryo is provided with a better chance of success. Frozen embryo transfer can avoid the need for ultra-high dose luteal phase support by allowing an embryo transfer to proceed in a natural cycle. The embryo transfer procedure is a day procedure, usually performed in an embryo transfer lounge area located at the IVF lab. The embryo transfer procedure is normally performed with the patient awake. A partner or support person is welcome to attend. The procedure involves gentle vaginal insertion of an instrument called a speculum, which allows visualization of your cervix. A small tube is passed inside your cervix, through which a smaller inner embryo transfer catheter will be introduced. For some patients where speculum examination cannot be comfortably achieved, embryo transfer can be performed as a hospital day procedure under a sedation anaesthetic. We ask that you have a moderately full bladder for your embryo transfer. This allows accurate abdominal ultrasound monitoring of your embryo transfer. Having a full bladder also straightens the angle of your cervix, making embryo transfer technically easier and more likely to proceed quickly with minimal discomfort. From the morning of your transfer, ensure you drink at least 1 litre of water at home. Please empty your bladder 45 minutes prior to your embryo transfer appointment time, and then drink 2 cups of water. Try not to empty your bladder again until after your embryo transfer. The goal is to retain a comfortably full bladder during your procedure. While the bladder and the uterus are located next to each other, they are part of 2 separate body systems, the urinary tract and the female reproductive tract. This means that you can safely empty your bladder immediately after your embryo transfer. Before your embryo transfer, you will be asked to participate in a 3-point identification process by stating your name, date of birth, and address. This is part of a safety system to ensure the correct embryo is transferred to the correct patient every time. In addition to verbal checks, an electronic labelling system will confirm your identity label on your embryo culture dish. You will be given the opportunity to view your embryo under the microscope on a connected monitor before your embryo is transferred. The embryo must be returned to your body as soon as possible after removal from the IVF incubator to achieve its best chance of success. The ideal embryo transfer procedure takes no more than 15 minutes from the time you undress and prepare for the transfer until the transfer is complete. After an embryo transfer, you are free to go home, rest, or attend acupuncture treatment if desired. We prescribe gentle luteal phase progesterone support to optimally boost your progesterone levels after your embryo transfer. The aim of this treatment is to maximise your chance of a successful pregnancy. We will monitor your progesterone levels with a blood test in a frozen embryo transfer context to ensure it is ideal. Treatment adjustments can be made if needed to ensure an excellent level is achieved to promote and support implantation. You can continue your normal diet until your pregnancy test. When a pregnancy is confirmed, pregnancy dietary advice will be provided. You will be asked to attend your pregnancy blood test 10 days after a blastocyst embryo transfer or 2 weeks after a cleavage stage embryo transfer. If you have been prescribed egg quality boosting IVF supplements, these should cease when you are pregnant. A routine prenatal folate and multivitamin supplement can be commenced instead. Bleeding in early pregnancy can occur and is sometimes related to implantation. If bleeding occurs, you're advised to alert our team as soon as you can and to continue your progesterone medication. Early bleeding does not mean a cycle has failed. You must attend your pregnancy blood test, even if a home pregnancy urine test has been negative. Home pregnancy tests cannot quantify your beta-HCG hormone level and can, in some circumstances, register a false negative result at this very early stage of a pregnancy. Early pregnancy bleeding can occur in context of an ectopic pregnancy. We need to assess your HCG level following an embryo transfer procedure, even if your period comes. The possible outcomes after an embryo transfer are a negative pregnancy test, a biochemical pregnancy, an ectopic pregnancy, a miscarriage, or an ongoing pregnancy. It is important to guard your expectations and emotions, as not every embryo transfer will result in the birth of a baby. However, in time, most IVF patients will ultimately succeed. Every IVF baby starts with an embryo transfer.